We're not uniformly vaccinated, and there are some people who are not vaccinated. So the situation is there may be confusion about just throwing masks away. But if you're not vaccinated, you're still at risk of acquiring and transmitting infection.
So we have this kind of national honor system now. Mask guidance between states is still something of a crazy patchwork as health leaders like Dr. Fauci try to make sense of this new CDC mask guidance. Reports of new COVID cases, though, continue to trend down. 7-day average is now around 30,000. Cover of the New Yorker now illustrates hope toward ending this crisis as states begin to just peek through that open door at what life might be like at the other end of this. But some experts warn about celebrating too early.
We're still averaging 30,000 new cases a day. When we were at that level, when we hit that level in July last year, that was headline news. We're so profoundly underachieving in the South, and no one's really getting vaccinated. And then to lift the mask and insist on lifting the mask, I think could introduce a lot of risk into the system.
We are so happy to have back with us tonight Dr. Vin Gupta, critical care pulmonologist in Seattle. He's also on the faculty at the University of Washington Institute for Health Metrics and Evaluation. So, Doctor, we're coming off an administration that was decidedly in denial and anti-science into an administration that is pro-science but could maybe use an injection of sociology. Mask policy is a mess with states and companies and transportation making their own rules as they need to. What would you do to straighten out where we are right now?
Always good to see you, Brian. Good evening. If you're an employer, if you're a school or a district, if you're a restaurant organization, if you're an airline industry, you should certify who is and who is not vaccinated, bottom line. And Brian, I had a chance to join leaders from the National Institutes for Occupational Safety and Health today. And they're working with their colleagues across the government to issue guidance by the end of the week. And it seems likely that they're going to endorse that employers across society are okay and are encouraged to actually certify who is and is not vaccinated. And here's the reason why, because I'm sure there's some skeptical viewers out there. COVID thrives in cold, dry air. And so, Brian, we're entering a time of respite, the summer. COVID, like influenza, like other respiratory viruses, they don't like humid, hot air. So we're going to have a respite. We're going to have decline cases, decline hospitalizations. Come the fall, though, Brian, we're going to see a different reality. We're going to see a map of the United States where some places are fine, some places are not fine, places in the heartland, places where we have not seen increased vaccine uptake to the levels we'd like it to be. And so what does that mean? That means that we're going to see surges there. And so it's important to know, to anticipate, deploy for employers and school districts to know, wow, I might actually have a situation here that's dangerous come the fall and the winter. So it's patriotic. It's important to save lives that we certify who is and is not vaccinated so we can plan ahead.